Question 1. A patient is admitted with pneumonia and confusion. The nurse notes that the patient tries to get out of bed repeatedly without assistance. What is the nurse's priority intervention? A. Apply bilateral wrist restraints. B. Place the bed in the lowest position with an alarm. C. Administer prescribed sedatives. D. Ask family to stay at bedside 24/7. Answer: B. Place the bed in the lowest position with an alarm. Rationale: safety is the priority. Bed in the lowest position with alarms reduces fall risk while respecting autonomy. Restraints and sedation are last resort interventions. Family support is helpful but not a primary nursing intervention. Question 2. A nurse is providing morning care to a patient on contact precautions for C. difficile. Which action demonstrates correct infection control? A. Use alcohol-based sanitizer after removing gloves. B. Perform hand hygiene with soap and water after care. C. Wear a surgical mask while providing hygiene care. D. Dispose of linen in a regular hamper. Answer: B. Perform hand hygiene with soap and water after care. Rationale: C. Difficile spores are resistant to alcohol-based sanitizer. Soap and water are required. A mask is not needed unless droplet precautions apply. Linen must be disposed of in designated isolation bags. Question 3. A patient with heart failure is on strict fluid restriction. The UAP brings a pitcher of water to the bedside. What is the nurse's immediate action? A. Remove the pitcher and remind staff of the restriction. B. Document the incident in the chart. C. Notify the provider about the error. D. Allow the patient to drink a small amount. Answer: A. Remove the pitcher and remind staff of the restriction. Rationale: patient safety comes first. The pitcher must be removed immediately to prevent harm. Documentation and provider notification follow afterward. Allowing fluid intake violates orders and endangers the patient. Question 4. A nurse is teaching a patient how to use an incentive spirometer after abdominal surgery. Which instruction is correct? A. Exhale quickly into the device. B. Inhale slowly and deeply through the device. C. Hold your breath before using the device. D. Use the device only once per day. Answer: B. Inhale slowly and deeply through the device. Rationale: incentive spirometers encourage deep inhalation to expand alveoli and prevent atelectasis. Exhaling into it is incorrect, and frequent use, every 1 to 2 hours while awake, is recommended. Question 5. During morning rounds, a nurse finds a patient diaphoretic, pale, and with a blood glucose of 42 milligrams per deciliter. What is the nurse's priority action? A. Document findings in the chart. B. Administer 4 ounces of orange juice. C. Notify the healthcare provider. D. Recheck blood glucose in 30 minutes. Answer: B. Administer 4 ounces of orange juice. Rationale: hypoglycemia is an immediate threat. A rapid-acting carbohydrate should be given first, then rechecked. Documentation and provider notification come after stabilizing the patient. Question 6. A nurse is preparing to insert a urinary catheter into a female patient. During insertion, the catheter is accidentally placed into the vagina. What is the nurse's best action? A. Remove and reinsert the same catheter into the urethra. B. Leave the catheter in place and insert a new sterile catheter into the urethra. C. Ask another nurse to insert the catheter. D. Continue using the misplaced catheter for drainage. Answer: B. Leave the catheter in place and insert a new sterile catheter into the urethra. Rationale: leaving the catheter in the vagina helps prevent repeated errors. A new sterile catheter must be used. Reusing the contaminated catheter introduces infection risk. Question 7. A nurse enters a patient's room and notices sparks and smoke coming from an electrical outlet. What should the nurse do first? A. Unplug the equipment immediately. B. Evacuate the patient from the room. C. Call maintenance to fix the outlet. D. Activate the fire alarm system. Answer: B. Evacuate the patient from the room. Rationale: the first step is patient safety, removing the patient from immediate danger. RACE protocol starts with rescue before alarm or equipment management. Question 8. A nurse is caring for a patient who is refusing to eat due to religious fasting. What is the nurse's best response? A. You must eat to recover from your illness. B. Let's discuss alternative times and foods that fit your practice. C. I'll notify the provider to override your fast. D. Skipping meals is against hospital policy. Answer: B. Let's discuss alternative times and foods that fit your practice. Rationale: respect for cultural and religious beliefs is essential. Collaborating with the patient ensures individualized care. Forcing or dismissing beliefs violates ethical principles. Question 9. A patient requires a sterile wound dressing change. During the procedure, the nurse accidentally brushes a gloved hand against the bed sheet. What is the best nursing action? A. Continue since the wound is already colonized. B. Ask another nurse to complete the procedure. C. Replace the contaminated glove with a new sterile glove. D. Double glove over the contaminated glove. Answer: C. Replace the contaminated glove with a new sterile glove. Rationale: maintaining sterile technique is critical for wound care. Any contamination requires correction to prevent infection. Double gloving or ignoring breaks sterile technique. Question 10. A patient with limited mobility is prescribed compression stockings. What should the nurse do before applying them? A. Elevate the legs for 15 minutes. B. Apply lotion to the legs generously. C. Measure the patient's legs for correct size. D. Warm the stockings under a heat lamp. Answer: C. Measure the patient's legs for correct size. Rationale: proper fit prevents impaired circulation or ineffective therapy. Lotion may make stockings slippery and cause skin breakdown. Elevation may help edema, but sizing is priority. Question 11. A patient recovering from abdominal surgery reports sudden shortness of breath, anxiety, and sharp chest pain. What is the nurse's priority action? A. Assess oxygen saturation and apply oxygen. B. Notify the healthcare provider immediately. C. Reassure the patient it is anxiety. D. Position the patient flat in bed. Answer: A. Assess oxygen saturation and apply oxygen. Rationale: the patient may be experiencing a pulmonary embolism. The immediate action is airway support and oxygenation. Provider notification follows. Flat positioning may worsen oxygenation. Question 12. A nurse finds a patient with a history of dementia attempting to leave the hospital unit, stating, "I need to go home and feed my children." What is the most appropriate nursing response? A. You can't leave. You must stay in your room. B. Tell me more about your children and your home. C. Your children are fine. You don't need to worry. D. If you leave, I will need to restrain you. Answer: B. Tell me more about your children and your home. Rationale: redirection and therapeutic communication reduce agitation and risk. Dismissing or threatening escalates confusion. Question 13. A nurse is preparing medications for 4 patients. Which medication should the nurse administer first? A. Antibiotic for a patient with fever of 101 degrees Fahrenheit. B. PRN analgesic for a patient with pain rated 8 out of 10. C. Insulin for a patient with a blood glucose of 350 milligrams per deciliter. D. Cardiac medication for a patient with a regular heart rate of 36 BPM. Answer: D. Cardiac medication for a patient with a regular heart rate of 36 BPM. Rationale: a dangerously low heart rate is a life-threatening emergency requiring immediate action. Hyperglycemia and fever are urgent. but not as immediately life-threatening. Pain management is important but not the highest priority. Question 14. During discharge teaching, a nurse explains wound care to a patient. The patient keeps interrupting and asking about when they can return to work. What should the nurse do? A. Stop the teaching and allow the patient to leave. B. Redirect the discussion to wound care until completed. C. Address the patient's concerns, then return to wound care education. D. Tell the patient the provider will discuss work at the next visit. Answer: C. Address the patient's concerns, then return to wound care education. Rationale: acknowledging patient concerns helps improve engagement and promotes learning. Ignoring or deflecting concerns reduces understanding and retention. Question 15. A nurse is caring for a patient receiving IV antibiotics who suddenly develops hives, wheezing, and hypotension. What is the nurse's first action? A. Call the rapid response team. B. Stop the antibiotic infusion immediately. C. Administer PRN antihistamine. D. Document the reaction in the chart. Answer: B. Stop the antibiotic infusion immediately. Rationale: the first priority in suspected anaphylaxis is to stop the offending agent. Calling for help and administering emergency meds follow. Documentation occurs after the emergency resolves. Question 16. A nurse enters a patient's room and finds the patient on the floor with the side rails up. The patient says, "I tried to climb out." What is the nurse's first action? A. Call the healthcare provider. B. Assess the patient for injuries. C. Complete an incident report. D. Place the patient back in bed quickly. Answer: B. Assess the patient for injuries. Rationale: safety assessment comes before documentation or provider notification. Moving the patient without assessment risks worsening injuries. Question 17. A patient is ordered NPO for surgery, but a family member brings food to the bedside. The patient starts eating. What is the nurse's immediate action? A. Remove the food and explain the NPO order. B. Notify the surgeon immediately. C. Document the incident in the patient's chart. D. Ask the family member to take the food away. Answer: A. Remove the food and explain the NPO order. Rationale: patient safety requires immediate removal of the food and re-education. Provider notification follows to determine surgical implications. Documentation occurs after the situation is controlled. Question 18. A nurse is assigned a patient with a new colostomy. During teaching, the patient states, "I'll never be able to care for this myself." What is the nurse's best response? A. It's difficult, but you'll get used to it. B. Tell me what worries you most about caring for it. C. Your family can help you with this care. D. The doctor will explain everything at your next visit. Answer: B. Tell me what worries you most about caring for it. Rationale: exploring feelings allows the nurse to provide individualized support. Offering false reassurance or deferring education undermines patient confidence. Question 19. A nurse is about to administer digoxin to a patient. The apical heart rate is 52 beats per minute. What should the nurse do next? A. Hold the medication and notify the healthcare provider. B. Administer the medication as ordered. C. Recheck the heart rate in 15 minutes. D. Give half the prescribed dose. Answer: A. Hold the medication and notify the healthcare provider. Rationale: digoxin can cause bradycardia. A rate below 60 is a contraindication. Rechecking delays care, and giving the drug risks harm. Question 20. A patient admitted for dehydration reports dizziness when standing up. Vital signs are BP 92 over 58 sitting, 78 over 46 standing, heart rate 110 sitting, 124 standing. What is the nurse's priority intervention? A. Document findings and recheck in 1 hour. B. Assist the patient to lie down and notify the provider. C. Encourage ambulation to improve tolerance. D. Give the patient fluids quickly. Answer B. Assist the patient to lie down and notify the provider. Rationale: the patient is experiencing symptomatic orthostatic hypotension. The immediate priority is safety, preventing falls, and provider notification. Fluids may be ordered but not given without direction. Question 21. A postoperative client is reporting increasing pain unrelieved by prescribed opioids. The nurse notices a distended abdomen, absent bowel sounds, and tachycardia. What is the priority nursing action? A. Reposition the client for comfort. B. Notify the provider immediately. C. Administer an antiemetic. D. Encourage ambulation. Answer B. Notify the provider immediately. Rationale: signs of a possible paralytic ileus or internal bleeding, distension, absent bowel sounds, tachycardia, uncontrolled pain, require urgent provider notification. Repositioning A. Does not address the complication. Antiemetic C only masks symptoms. Ambulation D. Is appropriate for normal post-op recovery, but with these findings, it could worsen the situation. Question 22. A client with pneumonia suddenly develops restlessness, confusion, and SpO2 84% despite 2 LO2 via nasal cannula. What is the nurse's immediate action? A. Increase oxygen to 4 LNC. B. Call rapid response. C. Reassess with a full set of vital signs. D. Encourage coughing and deep breathing. Answer B. Call rapid response. Rationale: severe hypoxia with acute mental status change is life-threatening and requires immediate escalation. Increasing O2 A or encouraging coughing D wastes time. Reassessing vitals C delays life-saving intervention. Rapid response ensures advanced airway and emergency treatment. Question 23. A nurse is caring for 4 clients. Which client should be assessed first? A. A client with COPD who is using accessory muscles to breathe. B. A client with diabetes whose glucose is 210 milligrams per deciliter. C. A client with urinary retention awaiting catheterization. D. A client with a wound dressing that is saturated. Answer A. A client with COPD who is using accessory muscles to breathe. Rationale: airway or breathing takes priority. COPD client in distress is unstable. High glucose B is non-emergent. Urinary retention C is uncomfortable but not life-threatening. Dressing saturation D needs attention but not before respiratory distress. Question 24. A nurse administers IV potassium chloride and realizes it was given undiluted. What is the first action? A. Stop the infusion immediately. B. Notify the provider. C. Monitor cardiac rhythm. D. Document the error. Answer A. Stop the infusion immediately. Rationale: undiluted potassium is lethal and causes arrhythmias/cardiac arrest. The priority is to stop infusion immediately. Next steps include continuous cardiac monitoring, C, notifying provider, B, and documentation, D. Question 25. A client with chest pain suddenly becomes unresponsive, pulseless, and apneic. What is the nurse's first action? A. Activate the code team. B. Begin chest compressions. C. Apply oxygen via mask. D. Check the monitor for rhythm. Answer B. Begin chest compressions. Rationale: in cardiac arrest, high-quality CPR begins immediately. Code activation: A. Should follow, but compressions come first. Applying oxygen, C, is ineffective without circulation. Checking the monitor, D, delays compressions. Question 26. A client with sepsis has a BP of 78/42, heart rate 132, urine output 10 milliliters per hour, and mottled skin. Which provider order should the nurse carry out first? A. Obtain a blood culture. B. Administer IV fluids bolus. C. Start broad-spectrum antibiotics. D. Insert Foley catheter. Answer B. Administer IV fluids bolus. Rationale: shock state requires restoring perfusion first with fluids. Cultures A and antibiotics C are important but not life-saving in the moment. Foley D is not urgent compared to circulation collapse. Question 27. A client with end-stage COPD refuses BiPAP, stating, "I'm tired and I don't want it anymore." The family insists the nurse put the mask back on. What is the nurse's best response? A. Place the mask back on as family requests. B. Continue to encourage the client to wear it. C. Respect the client's wishes and notify the provider. D. Explain to the family that the client will die without it. Answer C. Respect the client's wishes and notify the provider. Rationale: the client has autonomy in decision-making, even if family disagrees. Forcing BiPAP: A. Violates rights. B. Ignores refusal. D. Is confrontational and does not respect ethical principles. Question 28. A client is receiving IV vancomycin. The nurse notes flushing, itching, and hypotension. What is the nurse's best action? A. Stop infusion and notify the provider. B. Slow the infusion rate and monitor. C. Administer diphenhydramine and continue infusion. D. Document findings as expected. Answer A. Stop infusion and notify the provider. Rationale: symptoms indicate red man syndrome or hypersensitivity reaction. Infusion must be stopped. Slowing infusion B. is unsafe during reaction. Giving diphenhydramine but continuing C. still risks harm. Documentation D. without action is negligence. Question 29. The nurse discovers that 2 units of blood were hung simultaneously on a client with CHF, who now shows crackles, dyspnea, and BP 180/96. What is the priority action? A. Stop the transfusion immediately. B. Elevate the head of the bed. C. Administer furosemide as prescribed. D. Call the provider. Answer A. Stop the transfusion immediately. Rationale: findings suggest transfusion-associated circulatory overload, TACO. The infusion must stop first to prevent worsening. Positioning B. helps, but only after stopping. Diuretic C may follow. Provider notification D is next, but stopping infusion is priority. Question 30. A client reports severe abdominal pain after laparoscopic surgery with a firm, distended abdomen and heart rate 138. Which intervention is most critical? A. Administer prescribed opioid. B. Assess for bowel sounds. C. Notify the surgeon immediately. D. Place the client NPO. Answer C. Notify the surgeon immediately. Rationale: signs suggest internal bleeding or perforation, life-threatening. Immediate surgical evaluation is needed. Opioids A. Mask symptoms. Assessing bowel sounds B. Delays urgent action. NPOD is appropriate but not the most critical. Question 31. A nurse is caring for a postoperative client who has an abdominal incision with serosanguinous drainage. The patient's BP drops from 118/72 to 92/60. Heart rate rises to 118, and the client reports feeling lightheaded. What should the nurse do first? A. Increase IV fluids. B. Call the surgeon immediately. C. Assess the incision and drainage. D. Apply oxygen via nasal cannula. Answer C. Assess the incision and drainage. Rationale: clinical judgment begins with assessment. The signs indicate possible hemorrhage. Before interventions or calling the provider, the nurse must determine if the incision is actively bleeding. A. Increasing IV fluids may help, but is unsafe without confirming the cause. B. Calling the surgeon is necessary, but assessment comes first. D. Oxygen supports perfusion but does not address the root issue. Question 32. A nurse is caring for 4 patients. Which patient should the nurse assess first? A. Post-op day 2 hip replacement reporting constipation. B. A client with pneumonia and O2 SAT of 84%. C. A client with diabetes reporting blood glucose of 190 milligrams per deciliter. D. A client with migraine requesting pain medication. Answer B. A client with pneumonia and O2 SAT of 84%. Rationale. Prioritization is guided by ABCs: airway, breathing, circulation. Hypoxemia with O2 SAT 84% is life-threatening. A is uncomfortable but not urgent. C is mildly elevated, not critical. D is pain, important but not priority over airway. Question 33. A patient with heart failure reports shortness of breath, has crackles in the lungs, and is restless. The provider orders furosemide IV. Before administering, what is the nurse's most critical action? A. Assess potassium level. B. Measure urine output. C. Check blood pressure. D. Administer the medication immediately. Answer C. Check blood pressure. Rationale. Furosemide, loop diuretic, can cause hypotension and worsen perfusion. The most immediate step before administration is to ensure BP is stable. A is important but not the most urgent. B is useful for monitoring renal function, but comes later. D is unsafe without assessment. Question 34. A nurse notices a new graduate preparing to administer digoxin to a client with heart rate of 52 BPM. What is the best immediate nursing action? A. Allow the student to proceed. B. Stop the student and recheck the heart rate together. C. Notify the charge nurse of unsafe practice. D. Document the incident in the patient chart. Answer B. Stop the student and recheck the heart rate together. Rationale. Safe delegation requires direct supervision. Digoxin is held if heart rate less than 60. The nurse must intervene, reassess heart rate, and teach the student. A is unsafe. C is secondary after addressing patient safety. D is inappropriate in the patient chart. Question 35. A nurse enters a room where a client with COPD is receiving 6 L-minute oxygen by a nasal cannula. The client is drowsy with respiratory rate 8. What should the nurse do first? A. Call a rapid response. B. Reduce O2 to 2 L per minute and stimulate the patient. C. Prepare to intubate the client. D. Notify the respiratory therapist. Answer B. Reduce O2 to 2 L per minute and stimulate the patient. Rationale. COPD patients rely on hypoxic drive. Too much O2 can cause CO2 retention and hypoventilation. The priority is to reduce O2 and stimulate breathing. A may follow if the patient doesn't improve. C is premature. D delays urgent intervention. Question 36. A nurse cares for a client receiving chemotherapy who has WBC 2000 per cubic millimeter, ANC 400 per cubic millimeter, and temp 100.9 degrees Fahrenheit. What is the priority action? A. Notify the provider immediately. B. Administer acetaminophen. C. Place the client in protective isolation. D. Encourage oral fluids. Answer C. Place the client in protective isolation. Rationale. An ANC of 400 indicates severe neutropenia. Infection prevention is the priority. Fever may be the only infection sign. A is important, but safety comes first. B treats fever, but not infection risk. D is supportive, not priority. Question 37. A nurse receives report on 4 patients. Which one should be seen first? A. A patient with chest pain radiating to the arm. B. A patient with COPD on 2LO2 with SpO2 of 91%. C. A patient with abdominal pain after appendectomy. D. A patient requesting insulin before breakfast. Answer A. A patient with chest pain radiating to the arm. Rationale. This is likely myocardial infarction, which is life-threatening. B is expected in COPD. C is discomfort, not emergent. D is important but not priority over chest pain. Question 38. A patient receiving a blood transfusion develops fever, chills, and back pain. What is the nurse's priority action? A. Stop the transfusion immediately. B. Notify the healthcare provider. C. Administer diphenhydramine. D. Check vital signs every 5 minutes. Answer. A. Stop the transfusion immediately. Rationale. These are signs of an acute hemolytic transfusion reaction. Stopping the transfusion prevents further antigen exposure. B comes after safety. C may help with allergic reactions, but not hemolysis. D is part of monitoring, but not first. Question 39. A client with a chest tube has 150 milliliters bright red drainage in 1 hour. What should the nurse do first? A. Continue to monitor. B. Notify the surgeon immediately. C. Clamp the chest tube. D. Increase suction pressure. Answer. B. Notify the surgeon immediately. Rationale. Bright red drainage greater than 100 milliliters per hour indicates hemorrhage, requiring provider intervention. A is unsafe. C is never done routinely, risk of tension pneumothorax. D worsens bleeding. Question 40. A nurse is caring for a client with sepsis on vasopressors who has a new order for central line placement. What is the nurse's best action? A. Prepare the client for bedside procedure. B. Verify informed consent. C. Ensure vasopressors are running via a central line. D. Notify pharmacy to prepare antibiotics. Answer. B. Verify informed consent. Rationale. Ethical and legal considerations require informed consent for invasive procedures unless emergent. A is premature without consent. C is correct long-term, but consent must come first. D is important but not priority here.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!